Welcome to Elevate Uplift, First National Dialogue. And I'm Nina Yusuf with NAPISEP, National Organization of API Ending Sexual Violence. I will do the kind of like introduction and logistic, and then we'll explain to you about the agenda. So Elevate Uplift is built on the foundation of lesson learned from SADI project. SADI is Sexual Assault Demonstrative Initiative, multi-years national project that help community-based organizations strengthen their service to support sexual violence survivors. And it's supported by a collective national organization, Minnesota Indian Women Sexual Assault Coalition, National Organization of API Ending Sexual Violence, and National Sexual Violence Resource Center Resource Sharing Project. And not only that, Elevate Uplift is guided by a circle of wisdom that provide direction, wisdom, connection, and influence. The circle of wisdom consists of agency and individuals with expertise in anti-sexual violence, healing, and social change work. We value the knowledge and perspective of our partners engaging in similar work, and believe that our collaboration is essential to supporting culturally specific, tribal, and mainstream program in providing comprehensive and trauma-informed services. So that is about Elevate Uplift. I just want to note, to let you know that we already started the recording, and the recording will end right before the question and answer. Right, so then in the question and answer, you can speak like freely. Okay. So we are thrilled and really excited about this national dialogue, because I think we thought about 100 people. That's what we expected, and we have about 500 people registered. And as of now, when I look at the participant, it's about 291. So with the intention, this national dialogue, we have the intention of lift up survivors of sexual violence in the margins and in the midst of the COVID-19, to have some kind of like a conversation. To have a conversation together, sharing space and knowledge nationally. And as much as we want this as a sharing space, we are new to this. We have not done a webinar in this capacity. So there will be glitches, whether it's like technical, in technical side, or from like the way we manage conversation. And we want to ask for forgiveness and apology, and and ask for grace before we start, because this webinar, it won't be perfect. As much as we like intentionally pay attention to accessibility, interpretation, closed captioning, that you have all the information in your email, it might not be perfect. So that's where we come with the intention that this is a sharing space, and we don't know what is the follow-up after this, and we can discuss that together. The time is only like 1.5 hours, and it might not be enough for all your questions. And I apologize to the ASL that I speak fast. So, so again, for the panelists and facilitator, we have to remind ourselves to speak slowly and to give time for interpretation, the sign language, translation in Spanish, and also for the closed captioning. And please remind me if I talk too fast. So that's that. And then also a reminder that there was a question of like a poll in the beginning. I don't know if people answer that. I know some people answer on the chat, but we also supposed to answer on the poll. Valerie, Val, can you share like what is the result of the poll? Okay. There is someone in the car. There's the basement. Living room. So mostly in the living room. All right. Wow. Thank you. Thank you for facilitating this conversation and joining this conversation. And before we start, maybe we can center ourselves and just take a deep breath for a couple seconds and maybe visualizing like a comfortable space where you can be a part of this conversation for the next 90 minutes. Okay, drop your shoulder, take a deep breath, and out, in and out. Thank you. Just like pause a little bit. Val, do you want to show the second poll question? That's the second question. So here when we need like patience because we are figuring out, yes, there you go. So please answer the poll question. Okay. Val, do you want to share the result? Ooh, cloudy and sunshine. All right, thank you. So maybe the cloudy, maybe it's like cozy and cloudy, and then the sunshine, you can be like bright and like energized, right? So again, we have interpretation, Spanish interpretation, and then ASL accessibility and closed captioning. Repeating that speak slowly, and then that we will probably answer slowly, and that we are going to pause for access to make sure that everyone can participate in this webinar. Again, that there might be technology glitch, and then we want to make a statement about harmful comments, that we will not tolerate harmful comments, and we acknowledge and understand that sexual violence and anti-racism work are interconnected, that we are collectively committed to doing this work with deep integrity and rooted in love, connecting our threads of truth and respect, and being accountable to each other, and with bravery to call each other out and call each other in in times of need. So like with that, just be mindful of where we're at and not making like harmful comments, because the impact of the COVID-19 is different for, each person, right? And we also understand that this time is triggering. And the flow of the agenda is, after this, we have 7 panelists, and each panelist will have 4 minutes to answer kind of like a question that we already prepared. I know 4 minutes is not enough, but I think we probably will do a follow-up. We'll see what happened with this first webinar. And I also want to, before we start, I want to say thank you to the all Elevate Uplift team and Circle of Wisdom in making this webinar possible. The panelists, you have the list of panelists in your email, and if you right click, actually it will open to their short bio. So you can see kind of like who they are and what they do, right? And then we prepare 5 questions. I will read it so then you have an idea what the question we have. One is, how are you seeing survivors in your community responding to the reality of COVID-19? What are some of the issues you have identified for sexual assault survivor in your community before COVID-19? And then how are these issues playing out during the pandemic? Are there new issues you are seeing during the COVID-19? So like what are the issues before? What are the issues now during the pandemic? And then is there anything new? And what are some of the strengths that your community bring to support survivor in this time of pandemic? And then also what kind of support for survivor to move through this time in uncertainty, because I think planning, it's almost like hour by hour and not even day by day, right? And then can you share some responses survivors have shared around COVID-19 and what kind of fears they experience? And then the last question is, how do you think COVID-19 will impact services profession in the long term? So I know that won't be enough, like 4 minutes won't be enough to answer those questions, but each panelist will somehow address the question. And the first panelist is Nicole Matthew from the Minnesota Indian Women Sexual Assault Coalition. Nicole, please. Yes, thank you.
Thank you, Nina. Hello, everyone. Good afternoon. A little introduction. Manadu Baneshikwe, Indigenous, Migasi, and Dodame. My name is Nicole Matthews. I'm the Executive Director of the Minnesota Indian Women Sexual Assault Coalition. We're a tribal coalition and in Minnesota, and a state or a national tribal technical assistance provider on sexual assault and sex trafficking. So, certainly I can't speak for all of Indian country, but for some of the things that we have seen for survivors in Minnesota and some of the things that we're hearing, we've been connecting with our members every week. I think for survivors, there's a lot of triggers, and I think it's important to point out that there has been an increase in suicides during this time, and so for service providers, to really make sure that are really making sure that they're reaching out, that they're giving people resources around suicide. People are also having to shelter in place with people that are causing harm to them, and just being further isolated from their normal self-care strategies. And so, you know, for many of us, culture and ceremony and prayer is really important, and we can certainly do those individually at home and with our families, but that's not always the safest place. And so there's a limited access to some of that. I think also along with that is the limited access to some of that for some of our relatives who are incarcerated. And then I think some of the other, you know, challenges that we are really seeing are, you know, some of the ways that our communities have limited access sometimes to technology. And so not being able to access Zoom calls, for instance, or ways of connecting with people that others might have. And so there's limited ability to connect with people, to be able to see each other. I think, you know, some of the real strengths that our communities have is that, one, we do have, you know, a connection to our spirituality. Many of us do, not all, to our spirituality, and that can be a real strength. And also, you know, we're sovereign nations, and so we get to decide what happens within the boundaries of our communities. And so we are seeing, you know, tribes who are being very thoughtful about not allowing people into that community. And that's their sovereign nation, so they get to have those rules and they get to decide. And so they are essentially setting up their boundaries, their reservation boundaries, and not allowing anybody in and out, which is reducing their risk to exposure, which I think is really great. And for our service providers to really, you know, I think it's important to point out that our service providers are often also victims, and so having to navigate that system as well, and looking at the different ways moving forward that our service providers will have to respond, and whether that be in shelter programs, because many of our tribal programs are dual domestic violence and sexual assault, or more of the community organizations. I think we're really talking through what does service delivery look like moving forward for you know, the next at least, you know, 6 months to a year, because I think we will be seeing some of this for a while. So I think that's all I have right now, and I will turn it back to you, Nina. Thank you, everyone, and I'm so happy to be in community with you all today.
Oh, thank you, Nicole. Again, you know, this is the time of when, for survivors, this is like triggering and feeling unsafe at home, and we don't see, we have to like to prepare for, like what Nicole said, from 6 months to a year, and that's a long time for not feeling safe, you know, and especially when you don't feel safe in your own house. And I don't know, I just personally take it like really in about suicide, you know. So again, like think, how can we support survivors in this kind of like uncertain time? And it's just not easy. Thank you, Nicole. The next is Amita Swadin.
Good afternoon, everyone. I'm going to time myself because, as Nina said, there's a lot of questions and I don't want to go over time. So I'll do my best to share here. My name is Amita Swadin. I use they, them pronouns. and I am the founding executive director of Mirror Memoirs. And we are a national nonprofit organization that is uplifting the leadership and the healing of transgender, non-binary, intersex, and queer people of color who survived child sexual abuse. So one thing I want to say about this particular COVID pandemic is it's not the only pandemic that our people are having to navigate, right? If you look up the definition of pandemic, I think it's very clear that we have also been having to navigate a more invisible pandemic of childhood rape worldwide. We have the pandemic of white supremacy. We have the pandemic of heteropatriarchy. These are ongoing pandemics as well. So for our community, COVID has merely illuminated the suffering that our people have been enduring and has put extra stressors on our people. The way that I see people responding, I think people who were doing direct service work already, I think about my dear colleague and Mirror Memoirs board member, Bambi Salcedo. She is a trans Latina woman who is the CEO of Trans Latina Coalition. So they run a drop-in center here in Los Angeles, where I live, where they provide food and clothing, and that service has continued. They do a lot of advocacy for transgender women who are currently in detention centers or who are currently incarcerated, and for trans women of color who are homeless. And so for these populations, COVID has made people even more vulnerable on a couple different fronts. Number one, unfortunately, there is still no mortgage moratorium. And so even though there is a call in Los Angeles County, and I think it's California-wide now, that you cannot be evicted, there has not been a rent cancellation. The only thing that we have in place is to have a couple months where you don't have to pay your rent while COVID is happening, but the understanding is that you will then pay your back rent once the COVID pandemic lifts. And for people who are transgender, non-binary, intersex people of color, these are folks who already faced employment discrimination. These are folks often who were forced to do survival sex work in order to pay their bills. How do you do sex work during a pandemic in which you can't be more than 6 feet within someone's personal space, right? These are folks who often are involved in the gig economy, doing speaking engagements at universities. Well, all of those speaking engagements have been canceled for folks. So how are you going to make the money to pay the rent back, right? So even though we have no evictions right now, I think there is a great fear that even more transgender people of color will become homeless because of the COVID pandemic. And I'll just point out that in Los Angeles, prior to COVID, we already had the largest population of homeless people in the United States. Last fall, we had 60,000 people living on the streets, and that's before COVID. The other thing that has been really hard in LA County is that the county's official response to public health crises and natural disasters is for people to rely on your neighbors as a first point of intervention. But for transgender and non-binary people of color, often your neighbors are a source of violence, physical violence, hate violence, right? It's the people around you who are often the most unsafe. So how are you going to rely on them for food, for medical care, for what we call mutual aid during this pandemic? And then the last layer of this, which is the violence that my communities have to navigate even outside of COVID, is violence from the state and violence from the blood family. And so what we're doing in Mirror Memoirs, since there is not really a safety net of state services, most of whom discriminate against trans people, we are in a political environment in which more and more there is legislation being fought for to criminalize the existence of transgender people. The state is often not a reliable source of aid. The blood family is often the place that people have been harmed as children and into adulthood, whether that's sexual violence or misgendering, people having to be in the closet about their gender identity or sexual orientation. these community networks of what we call mutual aid become literally the only safety net for people to survive. So for Mirror Memoirs, we are still running online programming, and we will be expanding that throughout May and June. But more importantly, we put all of our time and resources from mid-March through the end of April into raising $250,000, which we are distributing in a mutual aid fund to trans, non-binary, and queer folks of color throughout the country. And we actually got some folks internationally applying for that assistance as well. And then moving forward, what I hope COVID will change is, the collective grief and the collective trauma that we're all going through right now is something that our people as queer and trans people of color already had to navigate. So I hope that all of us who run workplaces, direct service providers, advocacy organizations, I hope that we will think differently about what it means to employ people who are having to navigate ongoing trauma and try to heal from past trauma, and that all of our workplaces moving forward will become a lot more trauma informed so that we can truly elevate the leadership of those who are most directly affected by oppression. Thank you.
Oops, sorry. Thank you, Amita, and thank you for highlighting the complexity about this pandemic, the pandemic that most people don't see, as about like child sexual abuse and then heteropatriarchy, and then how is the impact on with the COVID-19, where is the support and what is the support, like where to go and how to find, how can like still be like surviving this time when the support it's not easy to find or to access. The next person is Anika Leonard, and I just want to also remind the panelists to speak a little bit slower. I know it's hard to put like 4 minutes, but so then it's giving the interpretation and signing time. Okay, thank you.
Hi, everyone. I kind of don't want to go. I just want Amita to talk some more. Thank you, Amita. That was so powerful. My name is Anika Leonard, and I am the president of an organization called Priceless Insight. It's an LLC, and we work to uplift the experiences of Black women and girls who are impacted by violence through prevention, intervention, and leadership development. And we also work with all communities. And so I am here to discuss some of the things that I've noticed within the communities of elementary, middle, and high school youth, in addition to young adults. And so what I am noticing, like Amita stated, like a lot of conditions in terms of oppression, in terms of basically institutional violence that young adults and youth have experienced are already present and underlying. And what COVID-19 has done is compounded some of those issues. So I'll just talk a little bit more about that. So I've noticed that there's been a economic hardship for some of the youth who, depended on the school to provide meals for them. And some of them don't have access to the internet. So when they are sheltering in place, they are not able to complete some of the work that they are assigned to do in order to pass on to the next grade. Some of the youth are, or some of the young adults, I should say, are frontline workers, and they feel the burden of being in a household, and now are the primary breadwinners for their family. Some of them do not have access to unemployment and have concerns about losing their housing. And a number of them are also experiencing the anxiety of being the frontline worker who is at the grocery store, working their butt off and feeling the anxiety from the customers who are, coming in to buy their groceries and, the customers that they're servicing. So some of the other ways that I'm noticing a lot of anxiety. And so that is connected to some of the housing dynamics. So many of the young people are in homes where people have harmed them. And many of them are in homes where people have complex trauma, and that trauma has not been addressed. And so it is being acted out when there's frustration around young people trying to access online classes and they are not able to access what they need to access and get the assistance that they need because they need additional help. And so there are some other things around participating in traditional rites of passage. So I'm hearing a lot of like, you know, I really wanted to graduate and I'm missing prom, you know, things of that nature. And I'm also hearing a lot of, like, I get a lot of calls from young adults and they're just basically asking for just support in general. I have a lot of young people who are young adults who are home from college and once again are sheltered in place with people who have harmed them, and also concerned about how they can concentrate on their online courses because they are, you know, sheltered in place with someone who's harmed them. And I'm sure that we can all imagine what that's like. And another thing that we're seeing, like we have had so many instances of domestic violence and in the Milwaukee community in general. And so that has heavily impacted, and it's nothing new, but I think it is compounded and increased the need for some mental health considerations in terms of what young people are experiencing and how they're processing it. And another thing that I am noticing, and I also wanted to note that there are a number of young, like my middle schoolers in particular are like, you know what, we don't like this. We do not like this. I miss my friends. There is the National Rape and Incest Hotline who have reported that for the first time ever, half of their visitors are minors who are reporting coronavirus-related concerns. Like 67% are saying that they have identified the perpetrator as someone in their family, and 79% are saying that they are living with the person who has harmed them. And so I believe that we are also seeing a lot of strengths that are coming from this pandemic as well. I am seeing a lot of young people utilizing social media, and they're utilizing it to like encourage their peers, like do check-ins, like how is everyone doing today, encouraging videos. I'm seeing a lot of video challenges, and a lot of those are intergenerational, and I'm not sure if anyone has seen them, but it is so encouraging for me to see young people, young adults, their parents, their grandparents, you know, doing these live challenges and dancing and laughing and just having a good time. And that is so encouraging. We've also seen a lot of non-traditional service providers like really step up. They are providing food pantries and accessing masks for frontline workers. One young adult, it has actually received community donations, and from those donations of fabric, she has sewn together masks and dropped them off to essential workers. And so we're seeing a lot of community members and also community-based organizations step in addition to the resilience that young people are showing through, you know, like accessing their joy. And another thing that I wanted to say is like there are community members who are adopting seniors and encouraging seniors to, you know, complete the year. You know, they are having citywide graduations. And I think that is so amazing that they're going to have a chance to walk across the stage. I've seen principals hand deliver signs that say, you know, class of 2020 and, you know, the name of the school, like this person is graduating. And I think those sorts of things are so important. And the last thing that I wanted to mention is that in terms of like what I see happening after this and what I see as hope, I think that we are going to really need to start looking at some of like funding non-traditional programs like community-based organizations because they're doing the work, and also accessing more of the arts because the arts, I believe, are a way for young adults and young people to heal in a indirect way, because a lot of young adults and young like middle schoolers, teenagers, they're not going to come out and say, hey, I have been sexually assaulted, but you may see other signs of trauma, you know. And I think that the arts and including the arts in in schools, in public and private schools, are one way to assist young people in processing through it if they don't have access to traditional counseling services, and which is another thing that I think needs to be funded. I also think that there's going to be a need for shelters, for drop-in centers, and transitional housing programs for young adults who are transient and without homes during this time. And so I just want to thank you all for giving me this opportunity and this honor to just report on what I have observed and what has been shared with me in terms of the needs of young adults, youth, teenagers. And what gives me hope is the idea that even though we are going through a collective trauma, as Amita has already said, I think that we have the ability to rise above this. Like we have experienced so much, and particularly as an African-American woman, I just feel that, you know, my people have been there and done that. You know, there's nothing that Black people have not gone through. There's nothing that Indigenous people have not gone through. There's nothing that we haven't gone through that we have not been able to resolve and to resist and to rise above. And I think that we just all need to do it as a people. We need to continue to rise and continue to bring love into our spaces. So thank you so much for this opportunity. And I'll look forward to any questions later.
Oops. Thank you, Anika, and thank you for highlighting the needs and the challenge that the youth, young adult, Black and non-Black youth of color need during this time. And one thing that sticks from what you said is about assessing joy. I think that's also like a strength and resiliency, because we are bombarded like every day by like trigger and traumatic events, and stepping up and using the strength to kind of like reach out, multi-generational. I think that's like amazing. And again, thank you. And Taylor is going to.
Yeah. Hi, Nina. Hi, everyone. We're going to take this time to pause for access. So again, we're going to just take a few moments and we will get started shortly.
Okay, start. Okay, so next is Connie Won. Where are you, Connie?
I'm right here.
Hi.
Hi everyone. It's good to be online with you. So thank you for having me be a part of the Circle of Wisdom, and thank you for everyone. I think there's about close to 300 of us on this call, on this webinar, so thank you for taking the time. I am a co-founder and executive director of an organization called AAPI Women Lead. One of the things that we do is we highlight the issues of intersectional violence that impact our communities, specifically self-identified women and girls. And then we also lift up the leadership of our self-identified women and girls. In all that is going on, I wanted to kind of share with you all some of the things that our communities have been experiencing. To begin with, there's a misnomer around Asian and Pacific Islanders that nothing is going on with our communities, that we are kind of unscathed generally in the United States and are pretty much forgotten when it comes to the US territories. Given that, I wanted to contextualize our communities' histories really quickly. As Asian and Pacific Islanders, we, generally speaking, I would argue, are survivors of multiple forms of violence. One is that most of us who are here in the United States are survivors of some type of war, meaning we came here to the United States as refugees. And that may mean refugees from colonial wars, imperialist wars. Many of us are also refugees of climate wars, right? we're called climate refugees, specifically our Pacific Islander communities. So these are the structures we come from. And when we come here, many of us are impoverished. Many of us don't come here with much money, many resources. And then when we are faced with what I like to consider institutional violence, we are not met with much support. So we have our structural violence, those things that I talked to you about, how many of us come to the United States through violence. In fact, today is April 30th, what people call the fall of Saigon. And it is also, for many of us, the end of the US war in Vietnam. So it's a reiteration, I wanted to reiterate that many of us come from war and violence. And then when we come here, we face institutional neglect and violence, meaning the healthcare system is not equipped with the languages, nor are they interested in serving many of our poor communities. So that makes it very difficult for our survivors to access care, let alone recognition for the violence that we've experienced. In a report that I wrote with NAPUSAV, we learned that some of our survivors have to continuously prove that we are what people call rapeable. So we are dealing with those kinds of institutional experiences. And then on the grounds, in terms of the gender-based violence that our communities experience, there is a lack of recognition that conservative studies have suggested that up to 40 to 60% of our Asian identified community members experience some type of physical and or sexual violence. And then in another report for our Pacific Islanders, there is an estimate of up to 60 to 80% of our Pacific Islander women and girls would have experienced some type of gender-based violence. So these numbers are huge, but the recognition is very limited. And that is one of the things that we have historically been experiencing most of our time here in the United States. So AA Peer Women Lead aims to highlight those numbers, and then we also aim to highlight the leadership of our community members as we traverse through what we call the United States and its territories. Under this specific climate, under COVID, what we are seeing is that our communities are experiencing anti-Asian violence. The way that that plays out is in a recent study, we're learning from March at the very least, there has been an increase of hate violence against Asians in particular. There have been 1,500 reports of some type of racial violence against our Asian communities. That's a huge number. That means close to about 100 something a day. And these are reported incidences. So our survivors are living under this climate of racial antagonism and racial violence. And then we also have the numbers, well, not the numbers, but we know that a number of our Asian and Pacific Islanders are our essential workers. Meaning we're the ones that are at UPS, we're the ones that are at, working in your grocery stores, we're the ones that are struggling to pay the bills at our local markets. And many people are divesting and disinvesting from those spaces because of anti-Asian violence and climate. So our survivors are trying to pay the bills under these conditions, right? We also have to think about the numbers of deaths and people who are the reports of COVID cases. In California, Asians and Native Hawaiians and Pacific Islanders are overrepresented in the number of deaths from COVID. And I sit with that. I say that because I want you all to check the reports for yourselves, because I don't want to issue the numbers here. They're a little startling for me. But it's important to note that Black and non-Black communities of color, Indigenous communities, Asian communities, Native Hawaiians, and Pacific Islanders are astronomically overrepresented in the data of deaths, meaning everyone is susceptible, but some people are dying. So what then does that mean for our survivors who are facing these larger structures of violence and these everyday occurrences? Many of our communities are, because we lack resources, because we lack access to language, there are no accountable or reflective language resources. A lot of our communities are not going to seek help, nor are we getting the support. I know that what we've been doing on the grounds and trying to institutionalize is we've been helping each other. We've been creating mutual aid projects that I know that Amita spoke about. AAPI Women Lead is fundraising up to $15,000 for local mutual aid projects. We also just partnered with the first Hmong American council member in Oakland to raise about $200,000 to support our communities across Oakland. So I say this, and I say it very quickly because I want to contextualize what our communities are experiencing and what we're trying to do. We're out here in these streets making masks for each other. We're out here in these streets dropping off food for one another because we know we're so isolated without resources. And the thing that I find so beautiful about our communities is we're trying to do it in solidarity with other communities of color. So the $200,000 that we're trying to raise, we're trying to make sure that it goes to unhoused communities. We're trying to make sure that it goes to OUSD, low-income Oakland Unified School District, low-income students and their families across communities. And that's being led by AAPI Women Lead and Sheng Tao, who is a Hmong woman. And a lot of our efforts are not noticed, and we don't need them to be noticed, because I think one of the strengths of our communities is that we do everything together, collectively, and that's how we see leadership. But what we would love for folks to do is to support each other in these efforts. AAPI Women Lead has also been launching a thing called Community Care Online. We've been talking to our healers, we've been talking to our acupuncturists, we've been talking to our yoga teachers, and they've been coming out giving tools and resources for our community. So that's our community care series online. We've also had our educational series. Our folks are educating our communities around the history of violence so that they don't think that this is sudden. So we're trying to support each other in these ways. In fact, Mira, who is helping coordinate everything on this call, will be one of our speakers to talk about what's going on in the Philippines. So this is just to highlight what's happening to us and what we're doing and ways that you all can support us, which is to essentially go online, learn from us, and support us in the ways that you feel are possible too. And to make your donations to everyone who are literally on the grounds. Our organization is 2 people. And if you look at it, the rest is our volunteers and our partners, and that's how we take care of each other. That's it.
Oh, thank you, Connie. Thank you for highlighting the history of violence and trauma that Asian and Pacific Islanders experience. And then on the flip side of that, also talking about the strength and the solidarity that's kind of like embedded in our community, that there is somehow like a structure of helping each other. But in this time, we also reaching out not just to help like our own community, but also how to help each other. Thank you again. And the next one is Wanda Swan.
Hi, I am Wanda Swan, the founder and executive director of the Swan Center for Advocacy and Research, which is a Georgia-based 501c3 that prioritizes survivors of violence who identify as Black and or African American. I want to apologize up front. I have a sleeping, snoring dog who is doing this thing. And so if you hear something in the background, just gonna let her do her thing. I am a founder of a nonprofit. I'm also a higher ed professional. I have 13 years experience in anti-violence leadership and direct service. And so I'm using both of those lenses when I have this conversation around COVID and survivor response. I think it's very interesting, and I appreciate Anika, Amita, Connie, everyone who came before me, because I feel that there's a natural build here that is important to name. I think responses to COVID as it relates to the communities in which I specifically speak to, those college-age students and those older within the communities, right? I think what's been quite interesting, just to give a little historical perspective, is how the narrative around COVID how that shaped and changed and impacted the African American and Black community. I think in the beginning, it was a narrative that was so removed, where Blackness was not centered, to the point that there was this very racialized myth circulating that Black folks can't get COVID, right? And that was the myth that was kind of going around a lot on social media. And also, it wasn't until there were some notable Black celebrities, and it was like, oh my gosh, this is a thing. And that prompted centers like mine and other centers that are dedicated specifically to Black healing from trauma in that way, to really ramp up the education, to really ramp up the access to these resources. And so I think it's most important, because once the numbers and the data actually reflected how African Americans and Black folks were impacted by COVID, there's a shift from language around the importance of staying safe and hunkering down to one of, we have to stimulate the economy and we have to get back to work. And I think a lot of that has some historical precedence, given the fact that, similar to what Connie suggested, is that historically African Americans in this country represent work that actually are represented or attributed to comfort, right? These are jobs that, whether they are your custodians, or whether they are your barbershops, or whether they are these small businesses or positions of support, that actually seem to create the space of leisure, right, for folks who are white and or privileged holding in that space. And so I think it's very interesting, and I think that that is a narrative that we don't talk about a lot, and who's holding these jobs, and what does that mean. I say all that because in order for us to even get to talking about African American survivors of violence, we have to talk about what surrounds that. And I think Anika did a wonderful job. She really brought a lot of things home for me as it relates to, when we're talking about oppression and we're talking about a pandemic over oppressive disparities, this is where we are. And so there are concerns around, for Black college students in general, right? There is concerns around housing. There is concern around economic security, belonging and community, academic insecurities, right? Can I afford this internet? Do I have a laptop at home? Even Title IX adjudications for survivors, right? And then in general, what we know in a larger frame, especially in Georgia, we know that there's an increase in IPV calls to centers. I think we're looking at like maybe close to 30% of an increase since COVID. And these are Black women who are utilizing these systems. I think some of the gaps that we're seeing is a lack of cultural competency, and also something that was pretty disappointing to me is mainstream media's coverage of COVID-19 related abuse. And it was not intersectional, right? And it was talking about a very specific type of violence. I think that what the Swan Center is doing to combat that is a couple things. I think that one of the things that we're doing is that we have created what we call Pandemic Safety Planning Working Group. And we're looking at service providers across all institutions, whether you are a nonprofit, whether you are a university, whether you are religious institutions, right? If you're doing the work of service provision, we want to be able to critically look at how are we actually taking a look at our intake processes, our measurements of lethality, our ability to safety plan, because all of this is upside down right now. All of the tactics that we would use is not specifically accessible. And so what we're doing is we are actually in the process of rewriting or revising and revamping our protocol and creating a comprehensive plan or comprehensive guidance that can be pushed out into our respective fields. And so that is something that we're very proud of. What we're also doing is we're having a donation drive for Black women and femmes in the state of Georgia who are impacted by COVID-19. And I think it's important. Yesterday I saw that nearly 80% of the folks in Georgia who are impacted by COVID-19 are African American. And so a lot of the questions around, well, why won't people stay home, or why this or why that? The answer is simply because how? How? If talking about building upon all of the oppression that we talked about earlier, who is going to care for, who is going to give aid, who is going to support? And I think that that's why you see small businesses making those decisions, right? And that's just not specifically in the African American community, but people are making life and death decisions right now because they don't have support systems or structures in place to protect. And so I think that there's a reframing of that conversation that needs to happen. I think that lastly, I would say that the impact of this will change. The impact of COVID will definitely change how we do service provision. It just has to. We have to adapt. We have to grow with this. And I think that what we'll be able to see is an opportunity, hopefully through structures like the pandemic safety planning, where we'll be able to have some flexibility in our service provision. I think that that will be one of the steps along the way of creating space to have an inclusive, comprehensive way to actually, and anti-oppressive, very important, way to support these folks. So I thank you so much for the Circle of Wisdom and allowing me to just have that time to clarify in that way. Thank you.
Thank you, Wanda. And I think, like what Wanda said, I think we can take also this time as an opportunity to create something new that work with our community and how we support each other. I think what happens, most of the stuff that we work in the past actually is not applicable anymore. And if we take this space and time to create a system that can like support our own community and other people of color community to more thrive and service that really support and understanding the history of the oppression that experienced from the past to like now. Thank you, Wanda, for highlighting the bravery and the steps that we need to take. And the next is Cynthia.
Hi, everyone. Thank you for spending this time and allowing me to be here and share with you today. I'm going to share and turn the discussion a bit to the topic of currently incarcerated sexual assault survivors. And just given the shortness of time, I'm going to keep my remarks briefer than I initially planned on. But I do think that what someone said earlier, that these conversations have sort of built upon each other. And we know that many of the groups that have been discussed today are overrepresented in U.S. corrections facilities. So let's kind of go into this portion with that framing. So due to the pandemic, the health and human rights of people behind bars are being threatened as never before. At just one state prison in Ohio, more than 80% of prisoners and over 150 staff have been infected. For many prisoners, life during this time consists of being cooped up in their cells, sometimes for all but 30 minutes a day, during which they must find the time to shower, get fresh air, and call home, provided that a phone is available and can be wiped down. Further, prisoners are finding that heightened restrictions on telephone and mail access are making it difficult, if not virtually impossible in some cases, to maintain contact with those on the outside. I didn't say it at the beginning, but I'm a deputy executive director at Just Detention International, and the focus of our work is to bring an end to all forms of sexual abuse in detention settings. And so at JDI, we remain in touch with significant numbers of incarcerated sexual abuse survivors through the telephone hotline that we run for prisoners in 2 states, and also because we receive letters from incarcerated survivors around the country. So these survivors share with us that they're anxious about becoming sick and being placed in isolation if they even seek medical care, and they're desperate for emotional support. And their worries are well-founded, right? There's no social distancing in prisons, jails, and immigration detention facilities. Most corrections facilities are overcrowded and unclean. Hand sanitizer is either forbidden as contraband or in very short supply if it is provided. And effective cleaning supplies are usually not available. Making matters worse, a huge proportion of detainees have underlying health issues that make them vulnerable to deadly complications from the virus. Many survivors in custody are finding that they're being triggered, some because they're locked in a small cell with an abuser for more than 23 hours a day, and others because of having to wear a mask and having that trigger memories of their mouths being covered by an abuser during prior abuse. Yet corrections healthcare systems are even less equipped than those in the community to deal with an explosion in sick people. Scarier still, the pandemic is creating conditions in which sexual abuse of prisoners can thrive. The lack of basic items such as soap, which is itself an affront to a person's dignity, leads to a scarcity that abusers can leverage. Corrections officials are also falling sick, and this leads to staff shortages that are dangerous for prisoners and staff alike. And at the end of the day, whether it's in a detention setting or the community, we know that reporting sexual abuse is never easy to do, but it's next to impossible if you can't write a letter or speak to someone that you trust on the outside. So I'm going to stop there, but I hope to be able to add a bit more to this during the Q&A. Thank you.
Thank you, Cynthia. Thank you for the kind of like highlighting the experience of about health and human rights of people behind the bar. And you know, if we think it's hard for us to access resources, and I think for people behind the bar is even like harder, and there is no social distancing and also access to healthcare and support. I just want to remind the participant that you can ask questions through the Q&A link in the bottom of the screen, because after Santa, we will have a question and answer session. Thank you. And next is Santa.
Hello, everyone. Wow, I just feel so very honored to be here with you all today. I'm just moved at the number of people that are on this webinar, and just really grateful to be part of this panel. So I know that we're short for time at this point, as we really do want to hear from you and answer your questions. My name again is Santa Molina Marshall. I'm a licensed clinical social worker as well as a holistic psychotherapist. I have a private practice in Washington, D.C. by the name of Holistic Psychotherapy by Santa, LLC. And what I'm seeing in the population that I work with, which is majority people of color, women and trans, is that there are symptoms that they ordinarily deal with every day. You know, when someone talked about the pandemic, there being many, and I'm looking at my notes here to call on Amita, who mentioned that the reality is that we do live, survivors of trauma live with pandemics all the time, right? So what I'm finding is an increase in the levels of anxiety, panic attacks, depression, the triggers that they are experiencing due to the fact that everything seems to be so out of control. And what do we know about healing from trauma? It starts with gaining a sense of some control, even if it is just of yourself, to be able to predict what's coming to you or at you, and also to know that things begin and end. And this pandemic is just so unpredictable. Things change every moment. There's so many contradictions, and that's the other thing that I see a lot. It's hard to trust in general, but how do you trust when things just keep changing? And there's so many different ideas about why this is happening. There's no leadership. So, when you come from experiences where there hasn't been appropriate parenting, living in dysfunctional systems, and perhaps you have learned how to cope with that, well, we're right back in those homes with this system that is so unpredictable and so uncaring. In some cases, these experiences of also being isolated or being asked to stay at home, to keep distance, only increase the level of stress, anxiety, trauma, because a lot of the clients that I work with don't have the space to create that sense of distance. And what about the families that are dealing with, my clients who are dealing with family members who have tested positive? They don't have the space to say, well, you go to that room or you go to the basement and be quarantined. I have clients whose entire families, both parents, children, are dealing with symptoms and have tested positive. So those are some of the things that I am seeing in my clients right now, and their inability to either their inability to focus because there's so much overwhelm. And the truth is that our nervous system can only handle but so much at any given time, but also because those resources that they use, their own internal resources, their own practices may not be available to them. There's just not enough space or time. I had a client not too long ago say to me that her biggest challenge as someone who's now also working from home on these computer systems is learning all of this. Well, I know that's a huge challenge for me and a level of stress. But she said, Santa, it's really hard to go from being the executive at the office on a computer where I feel totally, just inequipped, to being the mom who helps with the homework, to being the cook, to being just about everything, the nurse, and all of those transitions without transition, because people are just running from one place to another. The other thing that seems to be coming up is that of revisiting a lot of conflicts with perpetrator or parents who are still caring for or living with perpetrators. And what I mean by that is, again, I love sharing examples. Another client who shared that she was struggling a couple of weeks ago because she's very concerned about the health of her father, who's also her perpetrator, and what to do with that, how to navigate that. Whereas before she could just kind of create some sense of a barrier or filter between her and her extended family as an adult. Now they're reaching out to her, and there's this concern about what's happening, and her conflict of both hate and resentment, and still a lot of pain as a result of the trauma that she has endured and experienced, but also feeling so conflicted. How can you care and love and mourn someone that was so harmful to you? And those are not new issues. They just seem to be compounded during this COVID-19 time. Domestic violence is the other big thing. Again, having to be living in confined spaces, not having access to supportive resources, having to not even be able to create the plans. I've been trying to help a client get out of her home because there's active abuse, but there's also, someone who's showing some symptoms, and there's no space for this person. So really supporting them at managing the unmanageability, which, by the way, results in returning to or falling back into behaviors that are maladaptive. So I'm seeing increase in addictions of all sorts: overeating, alcohol, drugs, zoning out with television. Just a bunch of, how do I get out of here when I have nowhere to go? And, we as survivors are just so used to escaping. When we need to, we have the ability to emotionally escape. And when there's so much going on, it's hard to escape, because then you're also missing so much. The other thing that's critical is, I can say that our psychiatric medical systems are not equipped to deal with our people of color. They never have been. And with these increase of symptoms, clients are just really concerned about, do they seek support from the psychiatric medical systems? Never mind that emergency rooms are probably the last place they need to be in terms of the virus. What do I encouraging people to do? What am I encouraging? What do I see people doing? Is really trying to return to their deep-rooted practices, returning to their community gatherings. I have never heard of so many parties, birthdays, blessings. There's a funeral tomorrow for a client's family member online on Zoom. And yeah, those are privileges. But I'm glad that we're using them. And if not through these systems that allow us the visual, then making phone calls to each other, family members connecting that hadn't connected in years, just because you're calling to say, hey, are you okay with this COVID situation? So we are, and this has been said over and over today, we are resilient people. We have dealt with worse than this. We will survive. And we need to remember that. Holistic Psychotherapy by Santa is offering a blog. You can check that out. I'll put it in the actual chat. I offer blogs specific to survivors of trauma around this pandemic and time, and how to take care of ourselves, meditations, visualizations, support groups. I think that one of the things, I didn't share that I've been in the field for the last 30 years. And prior to my private practice, I was the clinical director, and for some time, the executive director of the DC Rape Crisis Center. And so I want to make this comment of what we're going to need to do is really be much more inclusive. I know that there are all kinds of agencies offering all kinds of services, but I do know that at our local rape crisis centers, the services are primarily for adult women or people who are raped as adults. And the reality is that, unfortunately, we know that there's so many people who have adult sexual assault that are also victims or survivors of childhood sexual experiences. We're going to need to start expanding our services, our mental health services, our counseling services, to include services to survivors of childhood abuse as well. And to really understand that perhaps most of us, and I don't know, but I know I am a survivor of childhood sexual abuse. And so something's going to need to happen in our organizations to accommodate the many staff that are also having their own experiences. And this idea that, you can work from home is extremely, extremely stressful, if it's even available to some. So I am just really grateful to be part of the Circle of Wisdom, and to be part of this group, and to acknowledge that we have experienced collective healing We will continue to experience collective healing. Please do not minimize or undermine what you're experiencing, your emotions, because we're also experiencing collective trauma, collective pain. And unfortunately, you know, not only as individuals, but our earth, our planet, our mother, our source is really processing a lot of people leaving the planet. There's a lot of changes without transition. Take time, take breath, take care of yourself, hide out wherever it is you can to just take a moment. And again, I'm honored and I give thanks to Uplift just for this opportunity. Thank you.
Thank you, Santa. And I think that is a nice closing